Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Okay, welcome back everyone. It is March 19th and we have updates on COVID-19 from, of course, Adrian Dixon and Bonnie Henry and Justin Trudeau, as well as Donald Trump today. And we're going to try something new. We did this yesterday. We posted a positive story all the way at the end as we're leaving, and we're going to try to do that every day. Find that one positive story where people are helping people to get through this, because that's what is actually important, and that is the most important lesson to really take out of this whole thing, is how we can actually help each other. So let's start off with Justin Trudeau today, with his message, and he's going to make some announcements again about things that are going on with the border between the U.S. and Canada. All right, so let's get to that first.
Minister now.
Over the last week, we've seen significant changes in what COVID-19 means for the country. Every day, we've had new updates for Canadians. We
introduced new travel restrictions to slow down the progression of the disease. For example, we are limiting non-essential travel at the U.S.-Canada border. We have invested in health and research. We unveiled an unprecedented economic plan.
That's how we will protect Canadians and the economy. I know it's also a lot to take in. People are having to figure out how they can work from home or close up shop temporarily. Parents are trying to explain to their kids what's going on and why school is cancelled. Right now, the last thing anyone needs is to be worrying about how to make ends meet. People need to know they have support for their jobs, their businesses, their industries. And that's what our government has been focused on since day one. Yesterday, we announced an $82 billion plan that will support all Canadians. This includes a whole range of measures, and people should be checking canada.ca for the latest information. Our team is hard at work with the public service in making sure these new supports get to Canadians as quickly as possible. They're doing a fantastic job already. And I'll have a long discussion with the Clerk of the Privy Council later today to talk about how we can support our public servants and ensure that Canadians can access these new programs. But the bottom line is this: we're giving you more help when you need it. If you're a parent, we're here for you, just like for the single mom of two who will get nearly $1,500 by the end of May because of the increase in the Canada Child Benefit and the GST credit. If you're worried about making ends meet, we've got your back. Just like for the family that was concerned about their mortgage and now doesn't have to make payments for the next 6 months. And if you're helping others, we're standing with you. Like with the Samaritan House in Brandon, Manitoba, that on Wednesday was able to open and deal with COVID-19 thanks to new funding. They were worried because their clients had nowhere to go since everything else closed. But now, with the new support, they can stagger entry to 10 people at a time, extend hours, and stock up the food bank.
We're going through a difficult time, but we will come through this together. Whether you need more time to pay back a student loan, or whether you're a farmer who's worried about his income, we are there for you. And we will continue to do everything we can to help you.
On health, we're continuing to pull out all the stops to keep you safe. We're moving forward on vital research for everything from better understanding how this virus spreads to developing vaccines and treatments. As part of the $1 billion fund I announced earlier this month, $25 million will directly support 49 researchers and their teams across the country. Their work is focused on developing and implementing measures to detect, manage, and reduce the spread of COVID-19. Across the country, scientists and researchers are working extremely hard. I want to take a moment to specifically thank them for all the essential work they're doing. At the same time, we will expedite access to COVID-19 lab test kits and other medical devices. The reality is that the need for these test kits is growing. Yesterday, Dr. Tam said that officials have now tested more than 50,000 Canadians since the beginning of the outbreak. 25,000 of those were done just in the last week alone. So while we ramp up, we're making sure Canada is ready to keep up. Ministers Haidu and Minister Freeland will continue working with the provinces and territories so that everyone has the resources they need. In times of crisis, Canadians come together. We've heard from businesses from coast to coast to coast who are telling us they want to help. Soon I'll have more to say about procurement and how industry can help with this effort. But until then, I want to let people know that we're working tirelessly to keep our hospitals, healthcare system, and Canadians supported. On that note, let me take a moment to recognize again the incredible work of our nurses, doctors, technicians, and other healthcare professionals. They are on the front lines of this, and they're doing a remarkable job. We need to support them and keep them healthy as well. But even if you don't work in a hospital, you can still keep people healthy. For example, we still need blood donors. So if you're able, consider going in and donating. Book an appointment online through blood.ca or by calling 1-888-236-6283. On a encore besoin de donneurs de
We
sang.
still need blood donors. If you are able to make a donation, we encourage you to do so. To make an appointment, you can look at the site or call 1-888-236-6283. We are also looking for other ways to help Canadians abroad. Earlier, I spoke with President Zelensky of Ukraine about this situation and how we can coordinate our work. I also talked to Premier Löfven of Sweden. Now, earlier this week, we announced a new fund to help people to receive up to $5,000 to return to the country or meet their needs in the meantime. We are also working with businesses and telecommunications organizations. They have agreed to send a text message to Canadians abroad about the consular services available. Ministers Baines and Champagne are working with their partners to put this in place, and we will continue to ensure that people receive all the necessary information. There is a lot of misinformation circulating, and we want to ensure that people know how to obtain help. I want to remind you that Canadians can come back to Canada and that they should do that. And all of those having trouble coming back, well, I can tell you we are working hard to resolve that situation. In fact, I talked to the leaders of WestJet and Air Canada about this very situation yesterday afternoon.
And weeks ahead hold. But there's no doubt these are uncertain times. But no matter what happens next, we can count on each other. So keep supporting your neighbors by picking up some groceries for them if you're already at the store. Check in with people on the front lines like cashiers and truckers, pharmacists and hospital staff. Take the right steps like staying home and working remotely to help flatten the curve. And as you do, know that your government is right there with you. We're working to slow the spread of this virus. We're taking steps to support you through tough times. There is nothing we won't do to keep you safe and to protect your health. Thank you. Merci tout le monde. Now happy to take your questions.
Hi, Prime Minister. Mackenzie Gray with CTV News. Yesterday, Premier Kenney in Alberta estimated that it won't be till May or June that social distancing measures will be lifted. How long do you think social distancing and having people work from home will be in place for?
We are going to continue to follow the best recommendations of experts. We've heard anything from weeks to months. We know this is a difficult and extraordinary time in which Canadians are taking difficult and extraordinary measures, and we will continue to do that until Canadians are safe.
Bonjour, Monsieur le Premier ministre, Raymond Fillon de TVA.
TVA, two questions. Border closures between the U.S. And Canada. Do you know exactly when that will come into effect? And your government has said several times in recent weeks that this will go on longer before it stops. So what is the worst possible scenario? First of all, with respect to the U.S.-Canada border, we are working together to try and finalize the details with our American counterparts, and we expect these measures to go into effect probably in the night of Friday to Saturday, so in a day and a half. Now, with respect to the various scenarios out there, we are aware of a variety of possible scenarios, and what we're doing with respect to the social distancing and closing shops, well, we believe all of this will keep Canadians safer, and we will continue to be ready for any eventuality.
We are continuing to work on the fine-tuning of the agreement between Canada and the United States. I think it's almost there. My understanding is that the measures will probably come into place in the night between Friday and Saturday, so in about a day and a half.
Spanovich, CBC News. Prime Minister, President Donald Trump yesterday signed the Defense Production Act, which would allow the U.S. military to help in the production of personal protective equipment such as masks, and the Italian military is also helping to produce ventilators. Canada has its own Defense Production Act with similar powers, so are you considering using them, and under what kind of circumstances?
Yes, we are considering using any measures necessary to ensure that Canadians and our healthcare systems have the supports they need. We've already been engaged with industry on production and ramping up capacity to build and create more equipment. We will, of course, look at military procurement as a solution as well. There's a range of things that we can do, and we will do what is necessary. Okay.
Yes, we are looking at all the possible measures that could be necessary to ensure that the equipment people need is available. We have already talked to many different manufacturers about the needs of our healthcare system and what they can do to help, but we will also be looking at other options, and that could include the military's participation. Mr. Trudeau, with respect to the airlifts decided on by Mr. Champagne, do you think that there are certain countries that are determined on a priority basis? And will you repatriate the people on the ship in Marseille? Well, we are receiving an enormous number of requests from all around the world. Canadians did receive a text message. Canadians abroad did receive that message, and which told them who to contact if they need assistance. As I said, I also talked to the CEOs of WestJet and Air Canada last night, and we pointed out to them that we need to work together to try and repatriate as many Canadians as possible on an emergency basis. With respect to the cruise ship, I have no information at this time.
As we said, we're going to work very, very hard to bring Canadians home. It's time for Canadians to come home from around the world. We recognize that will be a challenge. That's why we sent out a text message to all Canadians overseas with information on how to share their situation and get in touch with consular services. I spoke yesterday with the heads of our two large airlines, WestJet and Air Canada, to talk about how we can work with them to ensure that there are flights to bring Canadians home. We will continue to respond to the overwhelming demand by Canadians for support. We will be there to help them and get home as many people as we possibly can in the coming days and week. On the cruise ship in question, I don't have any specific information on that, but I'm sure there'll be further updates at noon on the regular press conference.
Guillaume Saint-Pierre, Journal de Montréal. Bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. What is your thinking about using the Emergency Measures Act, and how would that work? Would you need the approval of the provinces or of Parliament? And this is an option in terms of restricting movement between the provinces. Well, as I said, we will be looking at everything that can be done. We are not ruling anything out in terms of the options that we may want to rely on. At the same time, we do recognize that the Emergency Measures Act is an extreme law with certain implications that would also require us to bring back the House of Commons to pass these measures. So it is a major tool, and I can tell you that right now we already have a lot of tools that allow us to do what we need to do. If there are other steps that need to be accomplished and can only be accomplished through invoking the Emergency Measures Act, then we will do so.
Prime Minister Jane Pashagumska, APTN National News. Yesterday, you mentioned $305 million that would go to Indigenous communities to help with this pandemic. You mentioned a distinctions-based approach. Could you explain what that means for First Nations, status, non-status, Inuit, and Métis Nation communities?
We are going to be sending money to Indigenous communities for them to use the way they need to keep their communities safe through COVID-19 and support access to supplies they need and get through this difficult situation. We recognize that Indigenous Canadians are faced with greater health vulnerabilities and greater economic challenges than most Canadians at the best of times. There is a need for special support and special care for Indigenous communities and Indigenous Canadians right across the country. Minister Miller of Indigenous Services will be part of the press conference today at noon to answer more questions and to talk about specifically what we're doing with Indigenous Canadians.
Thanks, Prime Minister. Nick Taylor-Vasey from Maclean's. On small businesses who've had to shut their doors already and have zero revenue coming in, say that the help that was promised yesterday, won't help them if it doesn't get there in time before they go bankrupt. What about immediate payroll support?
We have made credit a lot easier to access for businesses of all sizes right now. Those were moves we made last week to ensure that there are loans, there is bridging financing available for businesses large and small. We've also taken specific measures on payroll support for small businesses that will be available in the near future. The help for Canadians will be flowing in the coming weeks. We recognize that this is a difficult time, both in terms of getting these new programs in place quickly enough to help Canadians, and that is why I'm going to be working with the public service to ensure that all our efforts are focused on supporting Canadians through this difficult time. We recognize that small businesses are facing special challenges, and that's why we announced measures yesterday to help them. At the same time, we had announced access to credit last week, a credit facility to help those businesses that are going through tough times right now, and also help for Canadians that need sources of revenue. Those sources of revenue will be coming in the coming weeks, and we're doing everything we can to get this done as quickly as possible. But obviously, we are introducing new programs in government, and that's why we're working with the public service in order to deliver.
Thank you. We'll now go to the phone for a few questions.
Thank you. Merci. The first question is from Marika Walsh from the Globe and Mail. Please go ahead. À vous la parole.
Hi, Prime Minister. I'm wondering what your message is to retirees who are seeing their savings dramatically hit by changes in the market. Is the government looking at, for example, supplementing OAS or GIS, or is there anything that you will be doing for them?
Recognize that the market disruptions are massive, and many Canadians have seen their retirement savings and pensions reduced significantly. We will be taking measures to ease the impact of that. We know that our seniors have worked hard all their lives to be able to retire in comfort, and there is a lot of anxiety there. That's why we will be there for our seniors as well.
Thank you. Merci. La prochaine question est de Mélanie Marquis de La Presse. À vous la parole. Please go ahead.
Merci. Bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. Yesterday, you unveiled an economic support plan. What are the work scenarios you're thinking of? Are we expecting job losses across the country? Do you have any numbers on what you're expecting in that regard? Well, obviously, we're looking at a lot of different scenarios and preparing for these various scenarios. We do hope that it will be as few as possible, and that's why we're trying to counter the spread through these various measures, whether it is by encouraging people to stay at home or encouraging people to work from home or helping people to get new sources of revenue if they cannot work. So we will come through this, we're hoping, with as little impact as possible and as few hospitalizations as possible. Of course, we're prepared for a more severe impact, but we are focused on the idea that we can avoid the worst possible scenario.
Thank you. Merci. And the question is from Hélène Buzati from Le Devoir. À vous la parole.
Oui, bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. There are a number of people who are stuck abroad and are asking for help to come back home. They left several weeks ago when the pandemic was already underway. And some people are saying perhaps they weren't careful enough. What do you think about this? And do you think we should nevertheless deploy resources to bring them back home? Well, I think what we're doing now is trying to help all Canadians. We're not going to make any judgments with respect to what people have done. We want to help them, and that's why we're working with the airline companies to try and facilitate their return to Canada, wherever they may be, because these are difficult times.
We're focused on bringing Canadians home. We're focused on trying to get our air operators to facilitate more flights to get Canadians home. We recognize that this is a very difficult and exceptional situation, and we're just going to be here for each other. Merci tout le monde.
And that's the Prime Minister of Canada addressing Canadians again for the fourth day in a row from his home, Rideau Cottage, here in the nation's capital, where he is now halfway through his own self-isolation with his family. Let's bring in the host of Power and Politics, Vashi Kapelis, and the CBC's David Cochrane, both here, as they have been daily, to help us make our way through some of the news that's come from both the Prime Minister and various ministers who will also be speaking shortly. I guess the biggest bit of news, if there was any there, because I really do think today was a message of reassurance, was around the border, which she says that these measures to limit non-essential travel between Canada and the U.S. probably coming into effect overnight Friday, so that's very quick, actually, just as quickly as they got the deal done in the first place. I'll start with you, Vashi. I'm not sure what else there was in terms of new information, but I think the importance of seeing the Prime Minister and him reiterating some of those key messages is needed by Canadians right now.
Yeah, I think that was certainly, Rosie, the strategy behind it. I would agree that the news out of this today is that he expects it to come into force overnight, Friday night. I would note that from the information I had yesterday, they almost expected the sort of T's to be crossed and the I's dotted by last night. So I am curious to find out exactly what specific details still require agreement on, because the deal isn't essentially, formally, I guess, signed at this point or agreed to. But anyway, they do anticipate.
Okay, so this next segment is Donald Trump. And Donald Trump has self-described himself as a wartime president because he is claiming that he is at war, well, we're all at war with as he puts it, the Chinese virus. So let's get to that clip and hear what he has to say, because there's something important from the FDA. They may have something new in the lines of treatment to help people get over the virus.
You probably shouldn't have anybody sitting behind you either. You should probably go back. But I love it. It's so much nicer. But I shouldn't say that because you'll get me now. Thank you all for being here. And we continue our relentless effort to defeat the Chinese virus. Before I begin, I want to start by announcing that today we are bringing home another American citizen. It was a big thing, very big. Omar Fakouri is on his way back to the United States after being imprisoned in Lebanon since September of 2019. He's battling late-stage cancer. Mr. Fakouri will now be able to receive the much-needed care and treatment in the United States. We've been working very hard to get him freed, and he's finally able to have his entire family at his side. So I'm very grateful to the Lebanese government. They worked with us, and we are very proud of his family. They stood by him so strongly, and they are thrilled. The United States has no higher priority than the safety and well-being of our citizens. We've gotten a tremendous number of hostages out, as you know. I think we're 42-0, and Robert O'Brien, as you know, was our chief negotiator for a large part of it. In fact, did so well that now we have him in a different position. So I want to thank and congratulate Robert and his team, and I want to let everyone know that recovering Americans held captive and imprisoned abroad continues to be a top priority for my administration. We have one young gentleman, Austin Tice, and we're working very hard with Syria to get him out. We hope the Syrian government will do that. We are counting on them to do that. We've written a letter just recently, but he's been there for a long time, and was captured long ago. Austin Tice, his mother's probably watching, and she's a great lady, and we're doing the best we can. So Syria, please work with us, and we would appreciate you letting him out. If you think about what we've done, we've gotten rid of the ISIS caliphate in Syria. We've done a lot for Syria. We have to see if they're going to do this. So it would be very much appreciated if they would let Austin Tice out immediately. As you know, my administration is working every day to protect American people and the American economy from the virus. Yesterday, I signed into law a critical support for American workers, families, and small businesses. It's a big thing. We're providing sick leave and family medical leave to those affected by the virus, and more help is on the way as we speak. Our entire team, headed by Secretary Mnuchin, is on the Hill. We're working with Democrats and Republicans, and there's a lot of goodwill going on. This was something that happened that was, some people would say, an act of God. I don't view it as an act of God. I would view it as something that just surprised the whole world. And if people would have known about it, it could have been stopped in place. It could have been stopped right where it came from, China. If we would have known about it, if they would have known about it. But now the whole world almost is inflicted with this horrible virus, and it's too bad. It's too bad, because we never had an economy as good as the economy we had just a few weeks ago. But we'll be back, and I actually think we'll be back stronger than ever before, because we learned a lot during this period of time. I also just invoked the Defense Production Act to help facilitate distribution of essential supplies if necessary. We're working with Congress to provide major additional relief to the workers, small businesses, and the hardest hit industries. We want to make sure that everybody is able to continue on so that when we recover, all of these companies and these great businesses, both very, very small and very, very large, are not going to be broken up and you'd have to put them back together. That would take a long time because we really I believe in the V curve. I believe it's going to go, when this is defeated, this hidden scourge is defeated, I think we're going to go up very rapidly, our economy, and get back to where it was and beyond. Today I want to share with you exciting progress that the FDA is making with the private sector as we slash red tape like nobody has ever done it before. Somebody was on yesterday on one of the networks and said that there's never been a president even close that's been able to do what I've done in slashing all of the red tape and everything to get very important things to the market, medical. So we slash red tape to develop vaccines and therapies as fast as it can possibly be done, long before anybody else was even thinking about doing this. And as you know, earlier this week we began the first clinical trial of a vaccine candidate for the virus, and that was launched in record time. It was just a few weeks, and that would have taken years to do, not so long ago. As we race to develop a vaccine, we're also pursuing antiviral therapies, and that's what really we're going to be talking to you about today. That's the purpose of being up here today. And to me, that's even more important. The vaccine, by its nature, you have to have long tests because you have to make sure what goes into somebody's body is not going to do destruction, do bad things. So you need long tests. And they're doing great with the vaccines, but it's still a long process. But the therapies are something we can move on much faster, potentially. And the treatments that will be able to reduce the severity or duration of the symptoms, make people better. Essentially, we're looking at things to make people better, or at the very earliest stages, they wouldn't even know they had it. And that's where I believe it's going to work even the best. The FDA Commissioner, Stephen Hahn, who's with us, he's fantastic. And he has been working 24 hours a day. He's been, he's worked like probably as hard or harder than anybody in the group, other than maybe Mike Pence or me. And what the FDA is doing is incredible. They've done things in times that were not even thinkable. And I've directed the FDA to eliminate outdated rules and bureaucracy so this work can proceed rapidly, quickly, and I mean fast. And we have to remove every barrier. There were a lot of barriers that were unnecessary. And they've done that to get the rapid deployment of safe, effective treatments, and we think we have some good answers. We'll find out very, very soon. Clinical trials are already underway for many new therapies, and we're working on scaling these to allow many more Americans to access different drugs that have shown really good promise. We've had some really good promise. We will do so in a way that lets us continue to collect good data to know which medicines are safe and which medicines are working the best. We have a couple that we're in really good shape on, and that's for immediate delivery. Immediate, like as fast as we can get it. The FDA has also approved compassionate use for a significant number of patients. You know what that means. We're also reviewing drugs that are approved abroad or drugs approved here for other uses. And you know, one of the things that I'm most proud of that I got was right to try. That's where somebody who's ill, somebody who's very sick, terminally ill usually, in past administrations, we signed this a year and a half ago, you wouldn't be able to even think about getting any of the drugs that may be showing great promise now. And they've been trying for many decades to get this approved, and it sounds simple, but it's not, because there's liability involved and lots of other things. And I was able to get it approved working with Congress, right to try. This is beyond right to try. What we're talking about today is beyond right to try. Right to Try has been, by the way, a tremendous success. People are living now that had no chance of living, where we take treatments that would, things that would have to go through years of a process. And if somebody was terminally ill, and I would say, why wouldn't they be able to try this? They'd go to Asia, they'd go to Europe, they'd go all over the world to try and find something. Or some people, if they had no money, would go home to die. They'd go home to die. They had no hope. Right to Try has been an incredible success. But this is beyond Right to Try. If treatments known to be safe in Europe, Japan, or other nations are effective against the virus, we'll use that information to protect the health and safety of American people. Nothing will stand in our way as we pursue any avenue to find what best works against this horrible virus. Now, a drug called chloroquine, and some people would add to it hydroxychloroquine. So chloroquine or hydroxychloroquine. Now, this is a common malaria drug. It's also a drug used for strong arthritis. Somebody has pretty serious arthritis. Also uses this in a somewhat different form. But it is known as a malaria drug, and it's been around for a long time, and it's very powerful. But the nice part is it's been around for a long time. So we know that if things don't go as planned, it's not going to kill anybody. When you go with a brand new drug, you don't know that that's going to happen. You have to see, and you have to go long test. But this has been used in different forms, very powerful drug in different forms. And it's shown very encouraging, very, very encouraging early results. And we're going to be able to make that drug available almost immediately. And that's where the FDA has been so great. They've gone through the approval process. It's been approved. And they did it. They took it down from many, many months to immediate. So we're going to be able to make that drug available by prescription or states. I spoke with Governor Cuomo about it at great length last night. And he wants to be he wants to be first on the line. And so I think that's there's tremendous promise based on the results and other tests. There's tremendous promise. And normally the FDA would take a long time to approve something like that, and it was approved very, very quickly, and it's now approved by prescription. Individual states will handle it. They can handle it. Doctors will handle it, and I think it's going to be. I think it's going to be great. Then we're quickly studying this drug, and while we're continuing to study it, but the studying is going to be also done as it's given out to large groups of people, perhaps in New York and other places. We'll study it there. There are promising therapies produced by Gilead, and that's remdesivir, and that's a drug used for other purposes that's been out and it's had very good results for other purposes, but it seems to have a very good result having to do with this virus. And that drug also has been approved, or very close to approved in that case, by the FDA. And I can't tell you how much we appreciate what the FDA, these people are incredible patriots, and the job that Stephen Hahn is doing. Dr. Hahn was one of the most respected doctors in the country, by the way, where we took him. I said, "You sure you want to do this?" Now, we didn't know that this was going to be in the playlist, what happened here, but he really has stepped up to the plate. Wherever you are, where is he? You really have. I'd shake his hand, but I'm not supposed to do that. Get in a lot of trouble if I did that. But he's been fantastic, and I thank you, Doctor. He's going to speak right after I'm finished. So, Regeneron again, is a company that's done fantastically well, as I understand, with Ebola and some other things. Great company. and they're looking at some very promising events also. So you have remdesivir, and you have chloroquine and hydroxychloroquine. So those are two that are out now, essentially approved for prescribed use. And I think it's going to be very exciting. I think it could be a game changer, and maybe not. But I think it could be, based on what I see, it could be a game changer. Very powerful. They're very powerful. So I want every American to know that we're doing everything we can, and these actions are important next steps. I mean, for the FDA to act the way they acted with this kind of speed is an incredible thing. Normally they'd say, well, we can have it by next year, or we can have it in 2 years from now. You understand? This is the way. Normally it's like years and years and years. They had it immediately, based on the fact that it's been used for other things, totally unrelated things. We believe these therapeutics and others under evaluation right now will be able to provide relief to many Americans. We really hope that's going to be. This could be a tremendous breakthrough. And we will work toward a much-needed vaccine in the future, as I said, and what we're doing with the FDA is so exciting in so many other fields. So many things are happening. It's a very exciting time for medicine. And we appreciate that the American public has pulled together. They're really staying home. And I think there's tremendous spirit in this country right now. It's spirit like a lot of people have not seen. People have not seen anything like it for a long time. And that means Democrat, Republican, they're pulling together. I hope everything's going good on the Hill. Maybe I shouldn't say this until I check out what's going on, because you never know. But I think there's a great spirit where the Democrats, the Republicans, and everybody else are getting together and they're trying to get things done. But most importantly, the American public has been incredible. We took the best economy we've ever had, and we said, stop, you can't work. You have to stay home. You know, there's never been a case like this. Normally you pay a lot of money to get things going. Here's a case where we're paying a lot of money to stop things because we don't want people to be together so that this virus doesn't continue onward. So there's never been anything like this in history. There's never been. Nobody's ever seen anything like this. But we're doing the right thing. We have to get rid of, our big war is it's not a financial war, it's a war, and it's a medical war. We have to win this war. It's very important. With that, I'd like to just introduce Dr. Stephen Hahn, and again, I'd like to send back with Stephen our thanks to all of the people working in the FDA who are fantastic, talented people. We appreciate it very much, everything you've done, especially the speed that you got these two elements, these two very important drugs passed. Thank you very much. Thank you, Stephen.
Thank you, Mr. President. I want to thank you for your leadership during this coronavirus outbreak, and thank you for the kind words about the FDA staff. We have 10,000 scientists, doctors, and others, and more than that, working around the clock to aid the American people in this fight against the coronavirus, and those words are very much appreciated, sir.
Thank you.
So before the President nominated me and I was confirmed as Commissioner of Food and Drugs, I was a cancer doctor. And I've sat across from countless number of patients and had to talk to them about their diagnosis and their treatment. And one thing that was really important is to provide hope. I have great hope for how we're going to come out of this situation. What's also important is not to provide false hope, but to provide hope. And as a doctor, that's the way I come to this. I'm speaking now to the American people as Commissioner of Food and Drugs, but that part of me has not left. Just look at the way the American people have responded to our calls for mitigation, for social distancing. The American people have great resiliency, and I am so incredibly proud of how the American people have responded. As the President mentioned, he asked us to be aggressive, to break down barriers to innovation, and to accelerate the development of life-saving treatments. And we're doing that at the FDA. The FDA is committed to continuing to provide regulatory flexibility and guidance. But let me make one thing clear. FDA's responsibility to the American people is to ensure that products are safe and effective. And yet we are continuing to do that. Our folks and their tremendous professionals are working day and night to do this. You just can't even imagine how much they're working to provide this support for the American people, and I thank them. Since early January, long before the first domestic case, FDA began working in collaboration with CDC. I also want to note that we stood up an incident command group and have been focused on the coronavirus since the very beginning of this public health emergency. This is, in addition, an all-of-government and all-America approach, and I'll describe what I mean by that in terms of the development of therapeutics. An important part of that work is expanding the potential therapeutic options associated with coronavirus, and we've learned from our colleagues across the globe about this. But I want to focus on one thing. I was a cancer researcher before all this, and one thing I know about this great country of ours is that we have unbelievable innovators. We have people who every day, it's their job to develop treatments for all sorts of diseases. We are incredibly blessed as a country to have this. And as is true in any illness, these great American innovators, academia, private sector, they have engaged us about the best possible treatment options. We are looking at everything that's coming across our desks as possible treatment options for coronavirus. And we're extremely encouraged by the interest and the promise that we've seen from these great American innovators. Now again, we need to look at it. We need the data. We need the information to make the absolute best decisions for the American people. But I want to assure you, we have over 17,000 people at FDA who are doing this every day. We need to make sure that the sea of new treatments will get the right drug to the right patient at the right dosage at the right time. As an example, we may have the right drug, but it may not be in the appropriate dosage form right now, and that may do more harm than good. Those are the things that's our job to look at, and that's why it's really important we have these dedicated professionals looking at these aspects of therapeutic development. At the same time, we're also working through different mechanisms to actually get drugs into the hands of providers and patients. The President mentioned this, but one of the mechanisms is called compassionate use. Let me just tell you about this. If there's an experimental drug that's potentially available, a doctor could ask for that drug to be used in a patient. We have criteria for that and very speedy approval for that. The important thing about compassionate use, and that's what the President meant, this is even beyond right to try, is that we get to collect the information about that. Because one of the things, and our promise to the American people, is we will collect the data and then make the absolute right decisions based upon those data about the safety and efficacy of the treatments. We are working expeditiously, and we are working to make sure that these products are as safe and effective as they possibly can be. Let me tell you about a few things that we're currently working on. And this is a plan that was developed with many of the people at this table, our infectious disease experts on the task force. In the short term, we're looking at drugs that are already approved for other indications. So they're already approved, as the President said, for other diseases. As an example, many Americans have read studies and heard media reports about this drug chloroquine, which is an anti-malarial drug. It's already approved, as the President said, for the treatment of malaria as well as an arthritis condition. That's a drug that the President has directed us to take a closer look at as to whether an expanded use approach to that could be done to actually see if that benefits patients. And again, we want to do that in the setting of a clinical trial, a large pragmatic clinical trial, to actually gather that information and answer the question that needs to be answered and asked and answered. Let me give you another example. There's a cross-agency effort about something called convalescent plasma. This is a pretty exciting area. And again, this is something that we have given assistance to other countries with as this crisis has developed. So FDA's been working for some time on this. If you've been exposed to coronavirus and you're better, you don't have the virus in your blood, we could collect the blood. Now, this is a possible treatment. This is not a proven treatment. Just want to emphasize that. Collect the blood, concentrate that, and have the ability, once it's pathogen-free, that is virus-free, be able to give that to other patients, and the immunoglobulins, the immune response, could potentially provide a benefit to patients. It's another thing that we're looking at. Over the next couple weeks, we'll have more information that we're really pushing hard to try to accelerate that. That's in the sort of more medium short term. And that'll be a bridge to other therapies that will take us 3 to 6 months to develop. And this is a continuous process. There is no beginning and end to each of this. This is, we're pushing this through. The other great thing about the great innovators of America, some of them tell us it's taken us years to develop therapies. They're looking at pushing that to the months period of time. And we're trying to provide them the regulatory flexibility, but at the same time the scientific oversight to make sure that gets done in the best way possible for the American people. The President mentioned that there is a vaccine trial currently being performed. It's a phase 1 trial, so it's the earliest study that gets done. We expect that to take 12 months to get to completion, to actually a time where we could approve a vaccine. But these are all things to bridge to the prevention part of this with a vaccine. It's exciting work, and the President is right. This is record time for the development of a vaccine, and impressive public-private partnership. The FDA's efforts to facilitate the development of these products are focused on ensuring timely access while also meeting the agency's world-respected gold standard, relying on strong data from clinical trials to determine if an experimental or an off-the-shelf drug that's used for something else can safely and effectively treat patients. We want to assure the American people that FDA is all hands on deck, as the President mentioned, these efforts, and continue to work with interested sponsors to help expedite the work. We remain steadfast in helping to foster the development of safe and effective therapies for COVID-19. Thank you.
Thank you very much. Mike?
I do want to point out something really important, though. There are a number of health researchers around the world that are actually claiming to have either better treatment or are about to go into trials with a vaccine for COVID-19. Among those is the U.S., Canada with extended treatments, and Britain as well as Israel have all stated that they're going into trials. They want to start testing things to actually help people get over or help us beat back this pandemic that we're in. Okay, so we're back here in BC, and there is another reported death. That death, of course, is related to the Lynn Valley facility, and as we are here in BC, our hearts do go out to those families who have lost their loved ones due to this virus in our area. So this next clip is Adrian Dix and Bonnie Henry making statements about what has been going on in how BC is handling the cases with COVID-19, and of course urging us still to maintain social distancing, but there's things that we can do as families and as special collective groups that we can do to stay connected. Okay, so let's get to that clip.
Feel long lines and empty shelves across the valley.
The problem we're facing now is when you go to the store, those items aren't even on the shelves to be able to buy. So I want to move these over here, Jade.
Jade Powell isn't picking all of this up for herself.
Bottled water, milks, canned goods, soups.
The pre-med student at UNR is launching a program called Shopping Angels.
It's been, something that I've been really focused on and brainstorming pretty intensely for the last 2 days.
No delivery fees, no extra costs. Powell just wants to help those who can't leave their homes.
When you coordinate with us, we'll give you the name of the volunteer who's offering to pick up your stuff, and you'll put them on your pickup order so that we can go out and get those groceries to you. Going to one store could be an all-day affair for an elderly person. They don't have a lot of money to spend on gas and, a lot of energy to drive around to all different stores only to find out that they can't even get the basic supplies that they need to last them for a couple weeks. We've gotten toilet paper, paper towels, cleaning supplies.
Anything you might need to get you through a couple of weeks, Powell already has more than 36 college students in both Reno and Las Vegas ready to help.
These boxes we're going to use for storing some of the stuff in so we can organize.
Powell says volunteers will be required to wear masks and gloves while picking up groceries.
So we're going to have this one.
And when they make their deliveries,
we also want our volunteers to not go inside the homes.
Powell has the supplies and the staff. She hopes seniors or their caretakers will now reach out.
So I think having something like this in place, ready to go, would definitely be able to benefit for future outbreaks.
Okay, as promised, we want to leave on a positive note. People helping people is the theme of this. And in this particular case, it's coming from out of the United States, where there's been a number of restaurants closed. You know what? Around the world, there's been a number of restaurants closed. Businesses have been forced to either temporarily close, and for small businesses, there's some questions about, are they going to be able to reopen? It's not just a matter of, the virus dissipated. It is a matter of, is there going to be funding to reopen? In this particular case, in Jonesboro, Arkansas, there is one landlord who stepped up to that answer. And he has told his tenants, especially the restaurant owners, that they should not worry about paying their rent, and they should worry about paying their employees instead. So listen to this clip from a news station in Jonesboro, Arkansas. Here we go.
New at 10, COVID-19 is hitting many business owners hard, and as they struggle to either close or reevaluate how they operate, one property owner is trying his best to lighten the load with a kind gesture. Attorney Taylor has more.
There's nothing like hearing it's on the house when eating at a restaurant, but now 5 restaurants are hearing that same phrase from their property owner after he decided to not take up April's rent. Managing a restaurant, employees, and even working to keep smiles on your customer's face is a challenge within itself.
Kind of a new experience for everyone.
But add the chaos of a virus that's quickly spreading to the mix and learning that it is recommended that you close your dining room.
This past weekend, we saw a 60% cut in attendance and, what we were bringing in revenue-wise.
More people staying at home means less money in companies' pockets. But one property owner says he understands the times we are in. Young Investments making this announcement saying 5 of their restaurant tenants will not be expected to pay April's rent.
I've been in this industry for 27 years and I've never seen anything like this.
Owners praising their landlord for his act of kindness.
Mr. Young doing that for us this month, that money goes straight to the employees.
And now they are paying it forward, ensuring that lights are on and mouths are fed even for their staff.
We consider them family, we don't consider them employees.
The weight of what's next now lifted off of shoulders.
Because it's been a lot of sleepless nights worrying about this.
But now the concern of what's to come even after April.
That old story, the grasshopper and the ant. We have to be the ant now. We've got to really plan and store and calculate everything that's happening and store it up.
Store up for the unknown and unseen.
This is a crisis that the restaurant industry has never faced before. It's nothing that we can change. Every day, it's a day by day.
And I talked to that property owner who made that big decision, and he says, as small business owners, a lot of people are hurting right now, but it was just the right thing to do. On Main Street, I'm Journey Taylor, Region 8 News.
Thank you for listening, and we will talk to you later. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.